to Sisters of Selling. My name's Rebecca Gordon, and this is my sister, Sylvia Gordon. Why'd you interrupt me?
I don't know.
I just started. I'm sorry. We're talking about Medicare Mania.
We're going to talk about Medicare Supplements. Okay, we're just only going to talk about Medicare Supplements. Just stay with me. Let's just do this. Medicare Supplements are expensive. I want a Med Supp when I'm 65. You want a Med Supp. And when I ever have rich clients come in and they're like, I'm rich, I don't have time for this, whatever, just give me the best coverage. I'm writing them a Med Supp. I'm writing them a G. I'm writing them a dental, a vision, a hospital. You know, you're giving them a whole package. They walk out the door. They don't care. Money doesn't matter, okay? Most of our clients are not in that position. Money very much matters. But still at 65, a Medicare supplement is very affordable in every state except for New York. Average price for a Med Supp in New York is going to be like $320.
Wow.
I mean, it's outrageous. Florida is a little bit of an outlier, a little bit more expensive, but most of the country, female turning 65, you can get a Med Supp Plan G, $100 to $130 a month. Okay.
Awesome.
Yeah, a man's going to be a little more, maybe 150. Okay. That's turning 65. It's just an easy rule of thumb. So for all of you new people out there that are like, well, what's better? Is a zero premium Med Advantage better than a Med Supp? Nothing's really better.
It depends on your situation.
Yeah.
Your utilization.
It's very
Your
much dependent on you, where you live, what's going on with your health. But for new agents out there, they're like, give me some shortcuts. There's so much knowledge I'm trying to learn here. If you're on dialysis, get a Med Supp. Because if you get an Advantage plan, you're going to pay 20% out of pocket. If you only have original Medicare, you're paying 20%. Get a Med Supp. If you are already having chemo, you got a little lipstick on your tongue. Stay on your Med Supp, okay? My rule of thumb is at 65, if you can afford a Med Supp, get a Med Supp. Start with a Med Supp.
Okay.
But talk to your client and say, you still have lipstick.
Stop it.
I'm kidding. I was a kid. That the first time I was
It's
serious.
absolutely driving me crazy.
The first time you really did have lipstick.
I'm going to do
Start with a Med Supp and then understand that it's going to go up 5 to 15% a year, depending on which one you bought. That's where the agent's expertise comes in. We're going to give you some idea. Did they file a new plan? Like you're going to talk about with Mutual Omaha, the rates are really smoking hot.
I won't talk about it. You will.
Or is it the end of that 3 to 4 year cycle where the rates are really we can give you an idea what company to go with.
It's the Med Supp shuffle.
But we can't control medical inflation. We can't control total inflation. We can just give you a prediction. Your Med Supp's going to go up a lot. And if it goes up 5 to 10% a year, after 3 years, a lot of people just say, I'm out.
Yep.
And they can't afford it. So they want options. And you have Med Advantage.
You go to Advantage, right?
Right? So I'd like to start people with a Medicare supplement, but some people don't want. They see all these ads on TV.
Right.
And they're like, I don't want a Med Supp. I want a zero premium with a flex card, with food card, with meals, with transfer. They want all that.
Mm-hmm.
So, you got to give people what they want. Explain to them their options.
You give a recommendation.
But I think we're doing a disservice. Agents used to work harder to sell a Med Supp. You got to get a check. They got to give you money.
Mm-hmm.
With Med Advantage,
just sign
here.
Right.
So I think agents have really lost their edge. They don't even try to sell Med Supp. They're like, yeah, it's expensive and it goes up and you'll be mad later. So let's just start here. So the key thing with Medicare Supplement is they do cycle.
Mm-hmm.
AARP less so than others. Very, very, very much less so. I would actually say AARP actually doesn't cycle. But most of them have followed Mutual Omaha and filing new carriers all the time and really getting those rates. So what's Mutual done lately?
New rates.
Da-da-da. Where?
Let's look at the map. All righty. So when we look at this color green, I'm going to call that a moss. Those are our latest, newest rates. Now, when you see the percentages, 12%, 12%, 12%, 7%, that's household discount. What is a household discount, Sylvia?
So notice it's called a household discount. In the olden days, it was called a spousal discount.
Back in your day?
Back in my day, back in the day when I started, You had to be married.
Gotta be married. All
And you had
times
to
have
be
changed.
married to an opposite gendered person.
Yep.
So now household discount means you live with people at least 12 months with some people. You got to remember when we're talking about mutual, we're talking about mutual. That all the companies do this differently.
They all have different interpretations.
So United Healthcare, AARP, is still spousal, I think. Spousal, which you could be legally same-sex couple too. Right. But some of them, it could be anybody in the house. It could be your nephew if he's over 18.
Right.
So mutual.
On these 12%, these, you just have to have somebody in your house that's lived there.
Now,
up to 3 adults.
Why do they say only up to 3 adults?
They don't want you to live in a nursing home.
Or assisted living.
And there's a whole bunch of people.
Right.
But it can be same sex. It can be common law. It just has to live together. 12%. And
I want to say something right now.
okay.
At one time, I got one of my clients a discount. We were talking, and she didn't have much money. And we're talking about her life, and she was kind of complaining about her no good nephew who dropped out of high school, who was sleeping on her couch. And I was like, he lives with you?
Household discount.
He's over 18? I said, how long has he been there? And she says, like 2 years. Ka-ching! She qualified. I mean, it gave me goosebumps because that was a lot of money for her. She was really struggling. And she was a nice lady letting her nephew live there.
Right.
Yeah. So
get a job.
Well, I don't know what's going on with the kid, but he's been on her couch for 2 years and she got a discount for it.
Oh, that's awesome.
Now, some of them, I don't even want to go into that, but do you lose the discount if that person dies? Some you do, some you don't. It's all over the board. All these rules are all over the board.
Some rules, the other person has to have a med supp as well.
Correct. And that's what you're showing up here. On this 7% discount with mutual, you both have to buy it?
Or you have to have a med supp.
I think you have to be 65 or older.
Yeah.
Versus being 18. So it's
Read
more
everything.
lenient. The 7% the 12% discount is much more lenient.
Way more lenient.
Way more lenient.
Yeah.
But this, just can you pull up a little bit here? This shows you just all the different charters they've used and the reason they do this is to keep refiling and get new rates.
New blood.
To get new competitive rates. Mutual of Omaha, United of Omaha.
So how do you
Omaha
know
Insurance, United World, Omaha Supplemental, which is the new one.
Of this, which are the newest rates? Or did they refile all these plans with new rates?
No, it's all cycling. So they just refiled like 6 states.
So if you want that information, hit us up in the comments and we'll send that map to you.
But the main thing is,
which I know is Indiana and I think it's Florida.
Right. There's a bunch. So and new rates are going to be low rates. There's nobody on the
smoking
business.
hot rates, and they've been stagnant for a while. So this should be a good fire sale, right? Because they haven't had refiled rates, so they should be very, very awesomely competitive.
And people love Mutual Omaha. Every older person talks about Mutual Omaha's United Kingdom. I have never sold a med supp that they did not bring that up and how much that meant to them.
It was awesome.
Like Sundays at 8 p.m.
It's like watching the Golden Girls.
Right.
Just very sweet.
Right. AARP also has new applications.
Yep.
So if you are not reading your emails, a lot of agents aren't, don't use your old apps. Make sure you have the up-to-date app.
And if we don't have your cell number, and I'm going to put that we need it because on these items, we realize people aren't reading their emails. So on Real Hot Things, we are texting them out as a quick text because everybody's looking at their text. If you're not getting our text, let us know in the comments. We'll have your marketer reach out to you. But anymore, emailing is just white noise.
People hate email.
I hate email. But I read.
If you want me, text me.
I read my text messages.
Texas is doing 5 med supps between July 7th and September 7th for a discount, agent bonus up to $300. I can't talk.
With what carrier?
Mutual of Omaha.
Oh, Mutual of Omaha.
Yeah. And typically we have a lot of med supp bonus right here before AEP that always kicks in.
Yeah.
Let's talk about Medicare Supplement Plan N.
Medicare. So a lot of people are scared of the Plan N because of the excess charges. They just don't feel comfortable talking about it, or maybe they don't actually grasp it.
And a lot of agents think that if you sell a Plan N, it's sky's the limit. By law, that doctor that does not accept Medicare can
15%.
only charge
15% over Medicare.
Just that 15%. And Medicare is extremely low reimbursement. So when you see it, I mean, I've sold N for years. It's my go-to primary plan. And I've never had a client yet that's paid more than $200 out of pocket. Part of it is because I really drill it home to my clients, which most of my clients being in Indiana, where excess is allowed. Don't go to a doctor that charges excess. You control that, just don't do it. That's part of your training. If you're gonna buy an N, you gotta ask, do you accept Medicare assignment? You verify that before you go to any of those doctors. Most of them do, the vast majority in the country do. It's like 86%. That could change anytime. But if you're in those states or in these states that don't allow excess,
it's a no-brainer.
Why are you buying a G?
This should be an absolute, the number one, N should be the number one plan
choice
you look at if you live in these fine states.
Ohio, Minnesota, the Northeast, which is Rhode Island, Vermont, New York,
Pennsylvania, Ohio. It's kind of weird. Ohio's in there.
Ohio, but I mean,
it's super weird.
You
N.
You need to look
at those N rates.
Clients call in, they say, my husband has a G, I want a G. I go through the G, I tell them the price, they're like, cool, give me the G. Then I say, okay, but let's look at the N. Now they've already agreed to pay this price. This one's gonna be 20 to 30 bucks a month cheaper, which on the face of it, it's like, but see a doctor once, copay's 20 bucks, that eats it up. It's not that monthly premium that's the reason I want them to buy N. It's the fact that N goes up much, much, much slower than a G. G is gonna go up like a rocket. No, N's gonna go up much slower.
It'll inch.
In the future, they're gonna be much happier with you, with their plan on that N. So if you are in those states, I hope to God you are looking at N. Now, not every carrier files an N.
Right.
Okay. But I hope you guys enjoyed this video just on MedSupps.
You did a fine job.
She's not carrying her weight.
You will not let me speak.
She's supposed to talk about ACA.
You will not let me speak.
Talk about ACA.
I try to speak and then
talk about
interrupt
ACA.
me.
Talk.
No, I'm done.
Join us next week
Good
when
selling.
we work out our sibling issues here.
I'm gonna call Mom.